When placing composite filling, several steps are required prior to placement of the composite material. Using proper bonding technique is critical to prevent postoperative sensitivity and to maximize longevity of the restoration by creating a completely sealed margin. There are many different adhesives used in dentistry, and they each have their own application technique. Today, we will demonstrate using a total etch single bottle adhesive, commonly known as a 5th generation dental adhesive.
Before starting, make sure you have all of your supplies ready. This would include a few microbrushes of multiple sizes, a dappen dish, 2x2 gauze, etch, and your bonding agent nearby. Wait to dispense the bonding agent until it is needed. Test that you have the right size microbrush for a proper application. If the brush is too large, you will not create a bond and failure of the restoration will result. To fit into a small prep, use a smaller brush such as this one. Once the tooth has been prepared by the dentist, rinse thoroughly to ensure that the tooth is completely free of any debris. Here we have a Class 2 preparation on tooth number 30. On our example, we have already placed a matrix band, wedge, and separating ring. The first step to the bonding process is to place etch. It is very important to check the flow of etch prior to placement on the tooth as we are doing here. If the etchant is difficult to extrude, it will take too long to cover the prep, causing over-etching of the tooth surface. This will lead to incomplete bonding and post-operative pain for the client. Begin by placing the etchant around the enamel margin. Be certain to start at the occlusal surface. Then carefully place it along the enamel walls and the gingival margin. During this initial step, try to minimize getting etchant on the dentin as much as possible. The next step is very important. Etch should not remain on the dentin for more than 15 seconds. Take these details very seriously as it means success or failure of the filling. After covering the enamel, place your syringe tip at the floor of the prep, starting in the proximal box as seen here. The moment the etch touches the dentin, begin counting to 15. 1 1000, 2 1000, 3 1000, 4 1000, 5 1000, 6 1000, 7 1000, 8 1000, 9 1000, 10 1000, 11 1000, 12 1000, 13 1000, 14 1000, 15 1000. Rinse the prep for at least 10 seconds, completely removing etchant material. After completely rinsing the etchant, lightly dry the prep with indirect air, being very careful not to overdry the tooth. Remove excess water with the HVE by hovering the suction tip over the tooth. Use your air water tip to forcefully blow water away from the band and wedge in the interproximal area. Be very careful not to blow directly into the prep. Use a microbrush to remove the extra water that remains in the prep. Gently blot the tooth with the brush and blot the brush on a 2x2 gauze or a corner of the patient bib to check how much water remains. When the material no longer shows water being absorbed by the brush, you are ready for the next step. Visually inspect the prep for any pooling of water. The dentin should have a damp appearance but not overly wet. If you see a chalky white color, the tooth has been over-dried. If so, reapply water, wait 1 minute, and continue with the bonding process. Now you are ready to place the bond. Always shake the bottle just before dispensing it into your dappen dish. This ensures proper mixture of the material. Make sure to only dispense 1 drop at a time. Place bond into the prep using a microbrush. Using the microbrush, agitate the adhesive into the prep, reapplying adhesive to the microbrush every 5 seconds for a total of 20 seconds. While placing the bond, ensure all surfaces are well covered. In this case, taking longer than 20 seconds will not be detrimental. However, not priming for enough time will cause post-op pain. Remove any bond that has pooled in the prep with a microbrush. It is most critical to check along the matrix band. Using your air water syringe, lightly blow air across the top of the band in the direction of the prep. This evaporates the solvent. This must be done for at least 10 seconds. An alternative method is to include the use of the HVE about 1 centimeter above the prep. Now stop and look at your prep. Prior to light curing the adhesive, the tooth should look shiny. There should be no pooling of the bond in any areas along the margin. Here is a picture of a well-coated tooth in the mouth prior to light curing. Light cure the prep for 20 seconds, ensuring the light is directly on top of the prep. After the adhesive is light cured, the entire prep should appear shiny and glossy. Here is a picture of a tooth in the mouth with the proper appearance. If it is not shiny and glossy, apply another coat of adhesive to the tooth in any areas of dullness. Air dry it very gently, cure, and evaluate again. If there are any questions, ask your dentist or restorative hygienist to examine it for you.